Wait, so how did your dad pass away again?
He has sleep apnea.
Sleep apnea, what's that?
Sleep apnea is a potentially serious sleep disorder in which breathing repeatedly stops and starts during your sleep.
Mm-hmm.
There are three types of sleep apnea. There's obstructive, central, and complex sleep apnea syndrome. Obstructive sleep apnea is most common form that occurs when throat muscles relax. The central sleep apnea occurs when your brain doesn't send proper signals to the muscles that control your breathing. Complex sleep apnea syndrome occurs when someone has both obstructive sleep apnea and central sleep apnea.
Oh, so do you know which one he passed away from?
He passed away from the central sleep apnea, which said that the brain didn't send signals to his muscles to control his breathing. Mm-hmm. He didn't have enough oxygen getting to his heart, which made it enlarge, and he passed away.
Wow, that's really interesting. Let's learn more. So there are two causes of sleep apnea. The first cause is obstructive sleep apnea. Obstructive sleep apnea occurs when the muscles of the back of your throat relax. These muscles support the soft palate, the triangular piece of tissue hanging from the soft palate, the tonsils, the side walls of your throat, and the tongue. When the muscles relax, your airway narrows or closes as you breathe in. You can't get enough air, which can lower the oxygen level in your blood. Your brain senses your inability to breathe and briefly rouses you from sleep so that you can reopen your airway. This awakening is usually so brief that you don't remember it. You might snort, choke, or gasp. This pattern can repeat itself 5 to 30 times or more each hour, all night, impairing your ability to reach the deep, restful phases of sleep. Factors that increase the risk of obstructive sleep apnea include excess weight, neck circumference, a narrowed airway, smoking, and nasal congestion.
After my dad passed away, we found out that he had central sleep apnea, and at the time we were not educated on the symptoms and the causes of it, and till today. So the causes of central sleep apnea. Central sleep apnea is the less common form of sleep apnea. It occurs when your brain fails to transmit signals to your breathing muscles. This means that you make no effort to breathe for a short period of time. You might awaken with shortness of breath or have a difficult time getting to sleep or staying asleep. Factors that increase the risk of central sleep apnea include being older, being male, heart disorders, using narcotic pain medications, and strokes.
Be aware that the signs and symptoms of obstructive central sleep apneas overlap, making it difficult to determine which type you have. The most common signs and symptoms include episodes in which you stop breathing during your sleep, which would be reported by another person, loud snoring, gasping for air during your sleep, waking up with dry mouth, morning headaches, difficulty staying asleep or insomnia, excessive daytime sleeping, which is also known as hypersomnia, difficulty paying attention while you're awake, and irritability. There's methods of diagnosis. There are two main tests that determine if you have sleep apnea and what type or types of sleep apnea you may have. A nocturnal polysomnography is conducted through equipment that monitors your heart, lung, and brain activity, breathing patterns, arm and leg movements, and blood oxygen levels while you sleep. The second test is called a home sleep test. Your doctor would provide you with simplified tests to be used at home to determine if you have sleep apnea. The test will measure your heart rate, blood oxygen level, airflow, and breathing patterns. If the results are abnormal, your doctor might be able to prescribe a therapy without further testing.
For mild cases of sleep apnea, your doctor may recommend only lifestyle changes such as losing weight or quit smoking. If you have nasal allergies, your doctor will recommend treatments for your allergies. If your apnea is moderate to severe, a number of treatments are available. 1. Continuous positive airway pressures, or CPAP, is a machine that delivers air pressure through a mask while you sleep. The air pressure is somewhat greater than of the surrounding air and is just enough to keep your upper airway passages open, preventing apnea and snoring. Although CPAP is the most common and reliable way to treat sleep apnea, some people find it uncomfortable. However, with practice, most people learn to adjust the tension of the straps on the mask to obtain a comfortable and secure fit. 2. If using a CPAP machine continues to be a problem, units that supply bilevel positive airway pressure, or BPAP, are also available. These provide more pressure when you inhale and less when you exhale. 3. Another option is to wear an oral appliance designed to keep your throat open. Although CPAP is more effective, oral appliances are easier to use. Some are designed to open your throat by bringing your jaws forward, which can relieve snoring and mild obstructive sleep apnea. 4. Surgery is usually only an option when all other options have failed. However, for a small number of people with certain jaw structure problems, it's a first option. Tissue removal is a procedure in which the surgeon removes tissue from the back of your mouth and the top of your throat. Your tonsils and adenoids are usually removed as well. This surgery helps in the stopping throat structures from vibrating and causing snoring. 5. Tissue shrinkage occurs when the surgeon shrinks the tissue at the back of your mouth and at the back of your throat using radiofrequency ablation. 6. Jaw repositioning happens when your jaw is moving forward from the remainder of your face bones.
With all disorders, syndromes, and sicknesses, there's complications. So complications that have to do with sleep apnea include fatigue, high blood pressure or heart problems, metabolic syndrome, type 2 diabetes, complications with medications and surgery, liver problems, and sleep-deprived partners. So daytime fatigue is the repeated awakenings associated with sleep apnea that make normal restorative sleep impossible, making severe daytime drowsiness, fatigue, and irritability more likely. You may have difficulty concentrating and find yourself sleeping at work, while watching TV, or even when you drive. People with sleep apnea have an increased risk of motor vehicle and workplace accidents. You might also feel quick-tempered, moody, or depressed. Children and adolescents with sleep apnea might perform poorly in school and have behavior problems. High blood pressure or heart problems. Sudden drops in blood oxygen levels that occur during sleep apnea increase your blood pressure and strain the cardiovascular system as a whole. Having obstructive sleep apnea increases your risk of high blood pressure, or also known as hypertension. Obstructive sleep apnea might also increase your risk of recurrent heart attack, stroke, and abnormal heartbeats such as atrial fibrillation. If you have heart disease, multiple episodes of low blood oxygen, it can lead to sudden death from an irregular heartbeat. Type 2 diabetes. Having sleep apnea increases your risk of developing insulin resistance and type 2 diabetes. Metabolic syndrome. This disorder, which includes high blood pressure, abnormal cholesterol levels, high blood sugar, and an increased waist circumference, is linked to a higher risk of heart disease. Complications with medications and surgery. Obstructive sleep apnea is also a concern with certain medications and general anesthesia. People with sleep apnea might be more likely to have complications after major surgery because they're prone to breathing problems, especially when they're sedated and lying on their backs. Before you have surgery, you might have to tell your doctor about your sleep apnea and how it's being treated. Liver problems. People with sleep apnea are more likely to have abnormal results on liver function tests, and their livers are more likely to show signs of scarring. And lastly, sleep deprived partners. Loud snoring can keep anyone who sleeps near you from getting a good night's rest. It's not uncommon for a partner to have to go to another room or even to another floor of the house to be able to sleep.
My dad, with him passing away from sleep apnea, he didn't have the best lifestyle. Um, his diet was very poor, and that's something that you have to make sure you have your best control over. Make sure what you eat is good for your body and it benefits your body in every way, because overweight is also something that does not help sleep apnea whatsoever. He lacked in his habits of exercising. He didn't take them serious. Only when it came towards the end, he took it more serious, but then it was too late. So you got to make sure that you start early. When you first find out if you do have sleep apnea, change your diet, exercise more, and do not smoke. My dad wasn't a big smoker, but when stressful times came, stressful measures also followed, and he would smoke frequently. But he wasn't always a big smoker. So don't inhabit that. Also, try not to drink alcohol as often. That's not good for you either way. Medications, he wasn't really on any type of medication besides the CPAP machine that he failed to use, and the oral appliances that we spoke about previously. He didn't take them serious because, like they said, it's very uncomfortable for some, but surgery was not an option for him. He was not a person who liked going to the doctor. He wasn't a person to take medications or to actually accept the fact that something was actually wrong with him. He always slept on his back, which is another thing that you're not supposed to do, because when you sleep on your back, it keeps your airway closed with people with sleep apnea. In most cases, you're supposed to sleep on your side to where you get the most airflow. And he was a person who slept sitting up on the couch. He fell asleep everywhere he could find comfortable. And when he did sleep in his bed, he slept on his back majority of the time. And when he passed away on his back. And just be aware of the preventions of sleep apnea.
So, estimates of disease prevalence are in the range of 3 to 7%, with certain subgroups of the population bearing higher risk. Despite the numerous advancements in our understanding of the pathogenesis and clinical consequences of the disorder, a majority of those affected remain undiagnosed. The prevalence of obstructive sleep apnea associated with accompanying daytime sleepiness is approximately 3 to 7% for adult men and 2 to 5% for adult women in the general population. The fact that prevalence estimates of obstructive sleep apnea from North America, Europe, Australia, and Asia are not substantially different suggests that this disease is common not only in developed but also in developing countries. Despite all of the clinical and scientific advancements regarding obstructive sleep apnea in the last 2 decades, a great majority, between 70 to 80% of those affected, remain undiagnosed. The lack of an appropriate level of case identification is partially driven by the fact that patients are frequently unaware of the associated symptoms that are often identified either by a bed partner or a family member. Compounding the lack of patient awareness, health professionals or healthcare professionals in most medical specialties have not received the necessary training to help expedite case findings and institute early intervention. Epidemiologic studies from around the world have consistently identified body weight as the strongest risk factor for obstructive sleep apnea. In the Wisconsin Sleep Cohort Study, a one standard deviation difference in body mass index, or BMI, was associated with a fourfold increase in disease prevalence. Other population and community based studies conducted in the United States and abroad have since confirmed that excess body weight is uniformly associated with a graded increase in sleep apnea prevalence. Moreover, longitudinal data from the Sleep Heart Health Study, Wisconsin Sleep Cohort Study, and the Cleveland Family Study show that an increase in body weight over time can certainly accelerate the progression of obstructive sleep apnea or lead to the development of moderate to severe disease. Thank you for educating me about sleep apnea, and again, I'm sorry for your loss.
Thank you. Well, if you have any close friends or relatives, loved ones, and they show signs of sleep apnea, please encourage them to go see a physician. Sleep apnea is one of the most common diseases that are overlooked and not taken serious. So urgently, if you anybody close to you show signs, please encourage them to see their physician or ear, nose, and throat doctor.